There we go. Hi, everyone. Welcome to the May Arch General Meeting. Thank you for joining us. I have some concerns about how grainy my video camera is, so I'm fingers crossed for no technological issues. But again, welcome. Um, for a couple housekeeping notes, a reminder to keep yourself muted unless you are speaking. Go ahead and introduce yourself, drop your name, and if applicable, your organization or company affiliation in the chat. We're going to have,
Hello.
hi. Second. Okay, that was strange. Um, from a housekeeping perspective, drop your name and, if applicable, your organization or company affiliation in the chat. We're going to have plenty of time for Q&A and open conversation during today's content. And it'll be an opportunity to take yourself off mute, or drop your questions in the chat. And we'll do our very best to get to them and make sure that they get answered. A reminder that this is being recorded so that we can make this accessible for everyone. If you'd like to access this meeting later, it will be uploaded on the Arch YouTube page, which you can find on our website up in the top right-hand corner. There's a little YouTube icon. A special note, as always, we will not be admitting AI companions into meetings. We do record these meetings, and as a matter of course, we just want the opportunity to redact it if necessary in order to protect confidentiality. Today we're going to begin with federal updates since our last meeting, and then move to some state and local updates. Last week we saw the House fiscal year 2027 appropriations bill be released and discussed. Similar to last year, the House rejected President Trump's budget proposal that I shared last month. While the House bill leaves a lot of room for improvement, there will be time to flex your advocacy skills to influence the federal budget process. So please stand by for future advocacy alerts on that topic. Um, we've been focusing quite a bit on the state, and we'll be shifting to federal advocacy soon. Q3 and Q4 COC program renewal awards were announced. That means that providers across the country will have the resources that they were assured in order to continue the work that we all do. This was not guaranteed. We were also notified, as I mentioned last month, that the anticipated drop date for next year's NOFO will be the end of May. We're at the end of May, so as we know more, you all will certainly know more as well. The state legislative session has almost come to a close. We've been paying attention and being very um, active to a couple of key bills. House Bill 616, which is Representative Knox's bill, which provides for oversight of publicly funded homeless service providers. It's scheduled today for concurrence. And what that means is that the chamber that originally authored the bill, which was the House in this case, is scheduled to vote on whether to accept or reject the amendments that were added to it by the other chamber, the Senate side. If they concur, the bill has successfully passed both chambers in identical form, and then it moves on to the governor for final approval. And we anticipate that this will happen. Um, House Bill 211 is Representative Villio's bill, which provides for the creation and administration of a homelessness court program. That's on its face value, how its short description was put forth, but it also proposes making unauthorized camping on public property a crime. Upon conviction, offenders would face a fine of not more than $500, imprisonment for not more than 6 months, or both. That bill is still subject to call, which means that they're waiting for someone that's willing to introduce it. And it's possible that it will be brought back to the floor as early as today. Um, it's been a rough legislative session, but I want to sincerely thank everyone, excuse me, who showed up, spoke up, shared information, made calls, sent emails, testified, shared on social media, or just simply stayed engaged throughout this legislative session. You knew what the bills were, you followed them in the news. Even though these two bills may not go the way that many of us had hoped, your advocacy mattered, and it helped bring real world experience and real humanity and accountability into these conversations in a real way. This work is not and is rarely linear, and progress is often measured by as much by the relationships that we build during the advocacy, the narratives we shift, and the people we mobilize, as by any single vote. So please do not underestimate the importance of what this community and the communities across Louisiana accomplished together during this session. Again, I know that it may not go the way that we had hoped, or many of us had hoped. But your advocacy mattered, and it will continue to matter. So please don't be disheartened into not mobilizing in the future, because we cannot afford to give up our voices and our experiences and our knowledge and expertise around these issues. Um, Renter readiness courses are ongoing. Again, thank you to the Louisiana Housing Authority for, sorry, Lafayette Housing Authority for their partnership in getting these classes established. If you're interested in having clients attend or anyone else interested, they are free, but they do require registration. The registration link is on your screen. So it's a bit.ly link, and it's just renter readiness, all one word, no capitalizations. Our next classes are today and then again on June 25th. Again, we offer it during the day at 1:30 and then again at 5:30. People bring their kids, we have toys, so we really are trying to make it as barrier free as possible. Um, and we work from everywhere from like how to find someone that you would like to live with if you need a roommate, and having roommate agreements, all the way through what are you looking for, how to search for a rental property, how to read a lease, what does eviction actually mean, how to be a good renter, what your rights are as a tenant, etc. And so it's really top to bottom. I think it's pretty fun. It's very interactive. People share their stories and they walk away, oftentimes with friends, or people who say, "Hey, I've got a great apartment next door to me that I have available." And so, again, it's free. While we are working in close partnership with those who are receiving vouchers through the Housing Authority, it's also a great class for high school students, college students, people who are maybe choosing to rent for the first time where they've been a homeowner in the past, and they need to kind of get used to that space. Or of course, people who are moving from homelessness into housing. So again, it's a free class. We offer it twice a month on the same day. And our next one, outside of today, is June 25th. Um, and then one last reminder, if you would like to make any oh no, I'm sorry. I have one other thing. We have shelter training. So as you all know, in partnership with many other agencies, including American Red Cross, Arch, Catholic Charities, um, the local Office of Homeland Security and Emergency Preparedness, LCG, etc., we have often and will often open as needed warming shelters, cooling shelters, etc., and then also in the event of serious inclement weather. Um, in order to mobilize volunteers and staff at those shelters, everyone needs to have uniform training. As we progress through having more and more of these shelters open, we've created more processes and streamlined and I think finessed the way that we work from an interagency perspective. So the next, we're looking at doing them annually. We did them last year in June. Where the next ones are Saturday, June 6th from 8 to 3. That is for general public. So if you have unaffiliated volunteers or a church group or something like that that you think might be interested in serving in that way, they should attend this shelter training. There's a complimentary lunch. Um, and it is from 8 to 3. It's lengthy, but they also walk away being certified as an American Red Cross shelter volunteer, which honestly allows them to be mobilized across the country or outside of the country when the American Red Cross mobilizes. So if they have wanderlust or they have a heart for doing disaster response, this is a great way to both serve our local community when needed and also have opportunities to serve outside of our community. And then if your agency works with the warming shelters, um, in any capacity, we are also asking for those staff members to attend on Friday, June 12th from 8 a.m. to 5 p.m. Again, complimentary lunch and and uh and they also will walk away as American Red Cross certified volunteers. Danae, will there be any other? Yes, we plan on having them with more regularity. We're just trying to get ahead of hurricane season. And so I fully anticipate that it will be um, happening again later in the summer in anticipation of either a cooling shelter or being very proactive for the warming shelters in the winter. Where are the trainings offered? There is a registration link that I will drop in the chat, but it will be offered on site where we have it at Brown Park, at the rec center. And that way there's a simulation and we can actually walk through in real time, at least the first shelter that we would stand up. Obviously, if it were a more serious inclement weather event, we would have multiple shelters, but this is the one that we open up first and most regularly with warming shelter. Um, I'm trying to think if there's anything else. Oh, one last reminder, if you want to make any changes to the way that you receive your Arch e-blasts, let's say that they're addressed to the person who formerly held your position, or you get it both at your work and your personal email, or you no longer want to receive them, please remember that there's an unsubscribe link at the bottom of every e-blast and then also a quick link to sign up on the newsletter or website. Sorry, the Arch website. So if you are like, oh, this person really wants to start going to the groundwork meetings, how does that happen? The registration link goes out to everyone who's on our eBlast list. And so if you go to archacadiana.org, at the top there's a tab that says newsletter. You click on it, you just enter your name and your email address, and boom, you'll start receiving everything. Of course, I don't want you to unsubscribe, but I also don't want you to get annoying e-blasts. So time now before we welcome our guest for any updates from any partner agencies or anyone out there that is attending that would like to share anything that's upcoming. I have some prompts on the screen that might be helpful in order to jog your memory. You can just go ahead and take yourself off of mute.
Hello, Rebecca with Faith House.
Hi, Rebecca.
I have a couple of updates here. First, we're going to have our annual meeting July 22nd at the Petroleum Club. Emails will go out next week for invites to the annual meeting. If you don't get an invite and are interested in going, just contact me at rebecca@faithhouseacadiana.com and we'll get you an invite sent out. Also, I've talked about this before, but our trivia night in Abbeville is June 27th. It's summer nights is the theme. We have a lot of people dress up. We decorate the tables. It's a really fun night. So if you're available on June 27th, we would love to have you at our Abbeville Trivia Night. So thank y'all so much.
Thanks, Rebecca. Anyone else have any updates or announcements or questions?
Hey, Elsa. This is Danae with the Louisiana Rural Health Association.
Hi, Janae.
I just wanted to share, we have what we call our Rural Health Policy Forum coming up on July 30th in Monroe. And it's focused on rural health legislation, advocacy policy, that sort of thing. But I know a lot of times there's overlap, particularly like in the Medicaid space and SNAP and those sorts of things. So if anyone's interested in attending that, I'll pop a link into the chat. Or if you want the opportunity to maybe network with some clinics and hospitals, that sort of thing, that's typically who attends. So I'll pop the link in the chat. Registration for that is open.
Perfect. Thank you so much. Sheila.
I'll go ahead. Can you hear me?
Yes.
Okay. Few things that we've been doing. The main thing, that we focus on this time of year is getting ready for hurricane season. I will be hosting, several trainings, and it's all for LDH staff, that would be activated and have to work in a shelter. Several days of those trainings coming up. We also will be we have staff that are assigned to work the LAVA, the volunteer table, at a shelter if we have to open, and we'll be doing those trainings also. This coming Friday, tomorrow, Lafayette Parish is going to be putting on an exercise. We'll be at MLK Center, and the exercise is teaching, it's several different agencies participating and teaching the staff. If there is an evacuation order for Lafayette, that will be one of the parish pickup points. And the parish pickup points, in case someone doesn't know what we're talking about, it's for people who do not have their own way, their own means of getting out of harm's way. So they're designated in the different parishes. It's mainly coastal parishes, but they have certain points that are already designated for people. It'll be broadcast over the news media, where they would need to go. And our staff will be there. We'll have a few of our nurses there because we do a real quick, simple triage as people get on buses. The Medicaid people will be there in order to, and the DCFS to register people, and they're practicing with the programs that we will be using. We have a hurricane summit coming up in Baton Rouge in June, and our parish directors, a lot of them are hosting in each of their parishes hurricane preparedness meetings. We've been going to those, and Nikki and I will be beginning to reach out in the near future to the low-income apartments. We've done this for the past couple of years. We hold meetings there at the apartments for the residents and the staff, trying to make them aware about evacuation, sheltering, parish pickup points, and just in general hurricane readiness. We also have been calling some of the hospice and home health. We get a list once a week with their at-risk population on it. And so we call and do some education with those facilities with their staff.
Wow, that's a lot. Thank you for sharing that all with us. And I think that if you want to be involved in disaster preparedness, there is a way to get involved, and it's always an intersection with all of our clients, whether they're housed, unhoused, or unstably housed.
We did send out through LAVA, asking any volunteers to come tomorrow, so that they could learn and see how it would work. So we'll see if anyone, but we did invite them.
Gotcha. Thank you so much.
Hey,
Any
so this
other?
is
Oh, go
this
ahead.
hey, this is Laurie LaFleur.
Yes.
So I'm here to introduce a new program that'll be rolling out later this summer with Louisiana Department of Health and the Office of the Secretary. It's called Project Mom. And Project Mom is a maternal overdose mortality program where our initiative is to reduce pregnancy-associated deaths due to opioid and substance abuse overdoses by 80%. And how we're going to do that is we're partnering with Beacon Ally Connection to provide some peer support to moms who may be identified or arrive in the ER that have had an overdose or identified as someone who has a substance abuse disorder. And then we are going to have other levels of support, such as myself, who is the regional navigator for Region 4. And once we get those moms stabilized with the substance abuse disorder, outpatient, inpatient, medical treatment that she needs, if she needs any assistance with any social determinants of health, such as housing, transportation, connection to Medicaid, SNAP, WIC, all those social determinants of health that they may need, I can do that and provide them some closed loop referrals, make sure they get all the resources they need. I know that my biggest challenge is going to be transportation and housing. So I'm glad to be here and learn about all these different avenues that I'll be using in the very near future. Project Mom is going to be in every region. We will be having some more press releases, but it will be in all 9 regions of the state. So we are here to assist prenatal and postpartum moms all the way through the postpartum period when the child turns 12 months. So that means that we can provide that continuous support for them as long as they stay in connection with us and follow up with us to get them the resources and change with the challenges that they may be facing. So I'm going to put a link to our Project Mom website on the LDH web. And I also put my email. If you have any questions, please feel free to reach out to me because we are currently promoting here in Region 4 because Region 4 is the pilot for Project Mom.
Wow. Okay. Thank you. Really excited about that resource.
Awesome. Thank you.
Hello, how are y'all? It's Wendy with the Acadiana Cares.
Hey, Wendy.
So our 28-day program is up and running, going strong, which transitions into our 90-day program that can transition into our Sober Houses IOP program. We have our clinic and our pharmacy with primary care, podiatry, and mental health services. We can only fill our own prescriptions for our own providers' prescriptions for Medicaid and Medicare, but we can fill your private insurance's prescriptions in our pharmacy. We also do STD and HIV testing 2 days a week until Tuesday and Wednesday until 7 p.m. So if you have any late tests that needs to be done, we're here till 7. And that's it. Y'all have a good day.
Thanks, Wendy. Any other updates? Okay, I did want to mention briefly that LCG will be installing no loitering signage in bus stops in Lafayette. And so if you have clients who are utilizing the bus stops for shelter, you will want to caution them that that signage will be going up and that's an enforceable policy. So wanted to give you all a heads up. All right, well, without further ado, I want to welcome back 2 years since she last shared at an Arch General meeting. I cannot believe it's been 2 years. My friend and colleague, Sarah Johnson, she's my counterpart in the region of Louisiana that's centralized in Monroe. Sarah, welcome, and I'm going to turn over hosting to you. Um,
Okay.
but for those who may not know your region well, because I think I probably just did a terrible job explaining it, can you share a little bit about your continuum of care, like what communities you
Sure.
cover, what pressures you're seeing right now, et cetera?
Okay. Well, let me see if
There you go.
let me navigate around and get to the screen. Can y'all see my desktop? It says it's a map.
Not yet.
Okay. Hang on a second. Well,
There we go. It's coming.
oh, all right. Now you see the map.
Mm-hmm.
All right. Northeast Louisiana is in the upper quadrant of the state on the right-hand side. And you can see from the map, these are our parishes. We have a big geographic area, but we don't have as many people. One thing we have a lot of is poverty, and I'll show you how we know that in a minute. These photographs that are here, this was from a photo uh, exhibit that was done in 1998 called A Day in the Life of Poverty Point. Poverty Point is actually a World Heritage Center up here, but it's also a general term for this area in this parish here, which is East Carroll Parish, which has at one point was the poorest county slash parish in the country. It shows the level of poverty that we live with up here all the time. Louisiana has a high rate of poverty, but in some of these rural parishes in the Northeast COC, we have more than half of the people who live in poverty. And that's the case with East Carroll Parish. We have a pretty serious out-migration problem with people leaving, going to other parts of the state for job opportunities, or other things. So we have lots of abandoned buildings. I try to go up once a quarter, calendar quarter, I try to go to all the parishes just to see what's going on. But East Carroll Parish takes the longest to drive to. It's almost 2 hours. And when you drive into the town, it's just street after street after street of abandoned houses that are boarded up. The urban center, we call it, is in Washita Parish, is the city of Monroe. We also have Ruston, which is in the Lincoln Parish, which is where Louisiana Tech is. So in many ways, we're very blessed. We do have some good opportunities up here. We have the universities. We have some families who have gone back generations and newcomers who come to town. And so it's got a very dynamic cultural life. Our culture is very different from Acadiana. We don't have that history of Acadian Cajun culture like y'all do. We're more traditional deep South. So we enjoy coming to visit you for that reason a lot. And the food here has that Cajun flair, but it's different here than it is there.
Um, it, as we're talking about House Bill 211 and 616, um, can you talk about what is misunderstood about rural homelessness? Our region as well has several parishes that are considered rural by the HUD definition. But as you're talking about the trends that you see in your area. What do you think is missed about rural homelessness when we're talking about legislation, et cetera?
Do you see the chart?
Yes, now I do.
Okay, I do a lot of statistical analysis of homelessness here and through LSNDC around the state, but we'll talk about that more in a minute. And I'm always looking for how to explain to people what's different in our area than the south part of the state. We're considered a rural continuum of care, a large rural one, but so is Acadiana.
Right.
So y'all have, if you could see from these figures, y'all have twice as many people-ish than we do. Our population here is about 347,000. Yours is 642,000. Our population makes up 7.5% of the state. Yours makes up 13.9%.
Mm-hmm.
But the percentage of people we have that are served by the homeless system here makes up 10% of the state's total, which is more than our share based on just population. Whereas in your area, about 11%, 12% almost of the people who are homeless there they represent about 12% of the total of Louisiana's homeless. This was in 2024. This was some 2024 figures, but I've found our percentages to continue pretty consistently
Mm-hmm.
through time. Probably one of the main things that differences here, I'm guessing that y'all are all familiar with the ALICE data, asset limited, income constrained, employed, which is the gap between people living in poverty and then people who don't live in poverty, but they don't make the wage that they need to cover basic living expenses in their area. In both our areas, we have about the same percentage of people who live in ALICE, but in poverty, in your area, it's about 1 in every 6 people, and up here, it's 1 in every 4 persons. So it's more of an issue here that a household may come to us and not have any income or have such low income that there's no way that they can sustain housing without having some kind of assistance.
Ms. Johnson,
Yeah,
may I interject something? I've lived in Northeast Louisiana my entire life until the past 3 years, and I got married at I'm gonna say an elderly age, and
I
moved,
wonder where you went. I thought, where did she go?
and I moved to Lafayette. I agree with you, and that some of the differences that I've seen
Mhm.
is that it seems that there may be more jobs available here in the deep south. There's a lot more oil jobs, those kind of industries. Well, we don't have any of that in the Northeast. And some of the things that I've seen is work, because I worked in a hospital for 20 years in Northeast Louisiana. And I worked at Conway, which if you've lived up there your whole life, you know Conway was our charity hospital. And I worked there for about 7 years. And one of the consistent problems and issues, and it still is today, is transportation for people. People out in East Carroll, West Carroll, Tensile. Tensile's another isolated, they didn't even have they had one little Dollar General store. I don't know whether they have a grocery store now or not, but I mean, they didn't even have that. But there weren't jobs, so there was not the opportunity to have an income or a substantial income. And they didn't have the automobiles. And so they had problems getting to a doctor, getting to a hospital. And when the women would have babies, and a lot of them were very, very young. We would see 13-year-olds.
Mhm.
They would have the baby and go home, and then they may only get to come visit it one time. It might stay with us in the hospital for 2, 3, 4, 5 months. And they didn't get to come and visit because they did not have transportation. And if they found someone that had a vehicle that would bring them, they'd have to pay them.
Mhm.
It's that type of thing.
It
And
is. I hear a lot, oh, well, we have an office in Monroe. Well, that's great. But if you're in East Carroll Parish and don't have a car, or don't have a way to buy gas, or don't have enough money to pay somebody to drive you to Monroe and back, it might as well be in Australia.
I
This,
do know that our administrator then with public health, he's retired now, but he saw the need, and it was in East Carroll Parish. And he done all the legwork, and he advocated, and he worked and worked and worked on this, and he got the monies to hire a driver and got a van. And that van then would go pick up people and bring them to the health unit for health care and visits and stuff like that. There needs to be more of that in all of those parishes, because those river parishes, all of them, are extremely poor.
they are.
Before we
The
move on, I have seen Danae with the Rural Health Association, Louisiana Rural Health Association, with her hand up. Danae, what you got?
Yeah, I had a data question. Excuse me. So you showed that it looks like your region up north accounts for like 10% of the total homelessness and unhoused, and unstable housing. And then the Acadiana is like around kind of the same, like 11%, something like that. Do you have the data specifically on of the rural population, how many of those folks are unhoused or have unstable housing?
short answer is yes, we do. It's not
Okay.
like packaged up so I could put it out there to you, but we actually do have it. And we'll talk about that a little more in a minute, because I want to show you the LSNDC website. And great kudos to Elsa for helping put that together.
Okay. Yeah, because my follow-up question was going to be, as we do grant writing and things like that, if we wanted to find that data, where's a good place for us to go for that?
Okay, we'll get there in a minute. All right, the main difference between homeless folks in South Louisiana and here, you can see on this chart. This is another chart that I did. This was in 2024, the comparison of homeless people who had encountered the homeless system in your area versus our area. In your area, 11% of the people who you serve were families with children. In our area, a third were.
Wow.
When we have, hang on, I put out a report every fall that includes not just the point in time data, but the total number of people that our records show actually move through the homeless system. And that's what you see now. We collect the data at the end of August. So in 2025, we had, for the prior 12 months, we had served 2,089 persons. And of those, 1,053 were adults and 1,036 were children under 18. So homelessness up here is very much about child and family well-being.
Mm-hmm.
I think it's a common misconception, and I think that's what we're seeing reflected in some of the legislation that is bouncing around in the legislature, that people who are homeless are mentally ill adults and they are choose to live on the streets. And I can't think of a better example than for somebody to come up here and see that. We look at the prevalence and the gaps in the available resources or capacity we have in our different shelters and things. And up here, we didn't necessarily need more shelters for individuals. We needed more shelters for families with children. And that's been our main area of focus for a while.
So, you mentioned LSNDC. You serve as the board president. I think you have for some time. Can you talk a little bit about the role of statewide data and responsible information sharing? Maybe thoughts that you have moving forward about how we can better shape policy conversations utilizing coordinated data. I think public understanding is always a challenge.
That's true, it is. People, it's one of our most common misconceptions is that there's not a lot of information about homelessness. Since every federally funded homeless program had to start collecting and reporting data in a shared database, homeless management information systems, we can't disclose private information, but we can look at aggregate data all day long. And we have over 2 decades of data that we can look at. LSNDC is a statewide body that has representatives from each of Louisiana's COCs on it. And we collectively make decisions for things that only impact the HMAS. For example, we all use the same software to do our HMAS data, so we can negotiate as a state with the vendor, and we get really good, better prices that way than we would if we each went individually. But another untapped resource for that, I think, is about all the data we've got. And we have access, the people on the LSNDC board of directors include all the state's HMAS administrators, the experts in managing that data and getting access to it in the system in a way that it can be reported and shared. And one of the things we did last year was set up a data page, which Elsa actually did. And she did such a good job. This is the data page. You can go to lsndc.org, and there is a really informative page with actual links to national data and region-specific data. Like here's a chart for the point in time count in the US. And then further on down, if you go down to the bottom, you can see that same data for the regions in Louisiana.
Danae, I want to jump in 1 second about your by parish. So typically you're going to get aggregate point in time count data per continuum of care. But there is no reason that we could not pull that by parish. It's just not typically how we report it to HUD. But in that, for example, Acadiana is a mix of urban, suburban, and rural parishes. We should be able, I mean, we can, and we should be parsing those, I think, externally. Whereas, Sarah, I believe all your parishes are considered rural.
No, Ouachita's not,
Okay.
but the other 11 are. We actually track anywhere somebody is when they're encountered and touch the system, we track which parish it is. as far as people in the point in time count, nearly all of those are in Ouachita Parish because it's easier to find people who are street homeless in an urban setting because there's fewer places for people to go. They're more likely to be visible. But in rural settings, we have thousands and thousands of miles of wooded area that is nobody ever, it's not under surveillance. There's not cameras. People can go out there and camp and live for a very long period of time before anybody encounters them. We're more likely to hear about an encampment from law enforcement than we are from an outreach worker.
And what definition does HUD use for rural? And it sounds like they use a whole parish, like they don't do it by like census districts or anything like that. It sounds like they do the whole parish as rural or not rural.
They actually use the census definition, which is the number of person per square mile.
Okay, so like the new census one,
Well,
because they changed they used to have, they don't have a rural definition in the census anymore. It's a whole thing.
Yeah, it's
Well,
old.
for example, I use the definition that like the USDA has a category, they can do definitions. There is information like that on the census website that you can pull.
Yeah, well, they used to have like specifically a rural, but now it's just like a non-urban and it's a little bit more complicated. So I was just curious because various agencies define rural differently. So I was just curious what the HUD specific definition was that they use. And if it goes by parish or by like track.
Parish.
By parish total, okay.
I think they use the old definitions. I don't know that they do anything any different. They use other entities' definitions. I don't think HUD has a specific definition for rural. They'll say, use the definition in such and such source. Or at least that's been my experience. Elsa, have you ever seen anything different than that?
No, and whatever that categorization is for that parish rarely changes. But there are grants that we are only eligible for if we have rural parishes.
Yeah. I helped one of our local providers wrote one last year for rural domestic violence, and I was helping her compile some information on that. And one of the parishes they served was Morehouse Parish, which you can't imagine getting any more rural than that. But actually, it ended up that 3 census tracts in that parish counted as urban. They didn't meet whatever the definition was for rural.
Right. That's why I asked, because we as the Rural Health Association, it gets very complicated depending on who the funder is, who we can and can't include in our catchment population for various things. So yeah, but thank you for that. Didn't mean to get too in the weeds of rural definition.
Well, we deal with it all the time up here too. We have, obviously, because we have so much rural geography, we can apply for grants that are specific to rural areas, but we have to be real careful, like you, in defining what areas those are.
Sarah, so, flipping the coin, are there things that you think that some strengths that you think that rural communities bring to this work that we don't highlight enough?
Definitely. I did a presentation to a couple of years ago on rural homelessness. And to me, one of the main things is there's a lot more of feeling that if you want it addressed, you've got to do it yourself. Like you can't wait. There's not resources to do a lot of things that there would be resources for in more populous parts of the state. For example, if instead of listing all different kinds of social service groups and public offices and like that, if you want to list the places in our area where people can go for help, they include the churches or de facto intake centers, the law enforcement or de facto street outreach people, teams. You got schools have a little bit of that, like they're a center for distributing things. If we want to distribute information and get it into the hands of parents, schools are a good way to do that. When was I had some extra grant money to pay for an ad for some, like a billboard, and I found out Tensas Parish didn't even have billboards. I mean, you have to be real creative in how you do. You can do it. You just can't do it the same way as somebody could do it in a more populous area. But there was the ice storm earlier this year in East Carroll Parish. There was a really good article in the Baton Rouge Advocate about how the people in that isolated parish cope with the ice storm. And they said if they had waited for emergency workers to come in and bring them food and help, they would have starved to death. But what the people in the town did was they all got together. They figured out who had a car or who could go and who was able-bodied, and they kind of sorted out the people who were housebound, and they split up, and they would take turns going to Monroe, picking up food or supplies or whatever it was, drive it back to the parish and distribute it to the people in the parish. And it went on that way for a while. Our area is traditionally one of the last ones served, and it's traditionally underfunded. But I think everybody down there is tired of me saying that.
I have one more question, but I do want to just say that I feel like this has been extraordinarily truncated conversation. And so if you would be generous enough in a couple of months to come back and maybe do a part two,
Sure.
because I think, if we're zooming in on Acadiana, I think that we have underserved our rural populations. I think specifically because it's more difficult to find people. It takes longer to establish the trust to introduce the idea of the expansive definition of homelessness to people who are very proud and are living in a home, even if it's not up to habitability standards, right? And so I think that your insight would be incredibly helpful for a part two of this conversation. But we had a question in the chat that I wanted to get your response to, which is when you present this data to legislators, how is it being received or responded to?
Their eyes roll back in their head. I think there's so much of a misconception about homelessness outside the group of us who deal with it and see it on a regular basis that it's almost, even if you show them numbers, it's almost impossible for them to conceptualize who that is. People tend to think things look like what they see. And in Louisiana, what we see, what the average citizen sees, is images of New Orleans, encampments under the overpasses, encampments different places. In Monroe, we have a Salvation Army in downtown Monroe, and some of our chronically homeless folks will sleep there at night when they can get a bed. So if you drive around this one section of downtown Monroe, you see the traditional looking, like they'll have their grocery cart or their bags or their whatever it is, and they're hanging out on the corner near the Salvation Army to get a bed for the night. Now, that whole area, we also have outreach workers down there. One of the biggest intake centers, two of them are down there. So they tend to hang out at those places during the day. But when it's time to you have to get a line, and it's first come, first served to stay at the Salvation Army. So they hang out there until they're allowed to line up. So if somebody's, and that's a very well-traveled part of town. So that's kind of what a lot of people see. There's the occasional panhandling up here, and people assume if someone is panhandling that they're homeless. I keep telling people, even if they're standing there with a sign that says homeless, they may not be homeless.
Mm-hmm.
One of my colleagues up here had a chronically homeless veteran, and they got him housed. So great. Well, she was driving to Walmart one day and he was standing there with his sign that said homeless veteran. And she said, Mr. So-and-so, what are you doing? He said, oh, well, I was just going to see if I could get a little extra money. And he said, what do you want me to do? She said, go home. Yeah, I mean, he was willing to change his sign so it said hungry veteran instead of homeless veteran. But and I even telling people that people here are so genuinely compassionate and want to take care of people who are in need. And I think that's probably what makes this area unique to me. But to me, it's indicative of Louisiana as well. We genuinely care about people.
Well, on that note, I want to put a pause on this conversation. I do want when we meet the next time, and we'll work out a date that works for you, um, how you all are pivoting when once the NOFO drops, or how you're making changes. And really, what does outreach look like? What does that trust building look like, in the rural areas? And then if we're seeing any effects of the bills that, um, I think we're going to be seeing be passed and signed by the governor. So anyway, I just wanted to say thank you. I'm so lucky to have you as a counterpart and often mentor. And so thank you so much for all the work that you do. And we're going to see you soon. Thank you to everyone else for joining us today. Um, please feel free to reach out to me at elsa@archacadiana.org with any questions or concerns. This will be uploaded later today onto our YouTube page. And then a reminder that we do not meet in June. We take the month off for summer, so many people are vacationing. So our next general meeting will be July 23rd at noon. And so, have a great day. There's only one more sleep until the weekend. And if you are, I will end this meeting and then restart it so you can hang on if you are going to be joining the HMIS meeting following this meeting. So thank you so much to everyone. Thank you, Sarah. And we'll talk to you all soon. Bye-bye.
Thank